Hey everyone, so today we're going to be going over cervical facet dysfunction. It's a bit of a secret shoulder killer. All right, so getting right into it. Who am I? So I'm a chiropractor here in Columbus, Ohio. I am a sport performance coach, mainly specializing in combat sport athletes, but I get a wide range of athletes, limited or not limited to, like sprinters, football, basketball, soccer, track and field, and even powerlifting. And that's mostly what this presentation is going to be about, is the lifting aspect of this. All right, so as a former adjunct professor at Wheeling University in the exercise science department, and I also currently serve as a consultant both to athletes and to sport performance programs as well. So what we'll learn today going through this presentation, we're going to be going over cervical facet anatomy, all right, cervical facet symptoms, and then treatment strategies based around what we're feeling and what we're seeing. So we'll dive right into it. We're going to look here at cervical facet anatomy. All right. So if we look all the way to the left, we're going to be seeing this lateral cervical spine. You'll see a little bit of a box. So within that box, you're going to see that cervical facet. And the facet is just kind of where the bones join up together. It's what allows them to move back and forth. So in front of that, all right, you can see the vertebral bodies. You'll see the disc in between the bodies. And then right behind that, so in between the disc and the facet, you'll also see the spinal nerves that come out. So if we look to the right, we're going to see what is normal facet anatomy. All right, so you're going to see the articular cartilage. You'll see the nerve root is right by it, the disc right in front of it. All right, the neural foramen that runs right next to that nerve root. All right. Now, if we get direct trauma, right, an injury to a facet, you're going to see this in the bottom left. All right. And that there starts to wear away at that articular cartilage there, which then narrows that space and can further irritate that nerve root. All right. Now, if we look a little bit more towards the right, the facet arthropathy, or just arthritis, like as we like to know it, a lot of lifters will end up with this. Okay. And this is common from just packing the neck and just being stiff as hell and not being able to move. All right. So if we get enough arthritic changes and irritation to that neck from not allowing it to move, from being hypomobile in that lower cervical spine, which we'll dig into a little bit later, we're going to end up eventually pissing off that nerve root and getting symptoms kind of moving down into our arms. All right. So cervical facet referral patterns, we usually see this in practice. Okay. So if we look on the picture on the left, that is going to be just, call it trigger points if you want, but these are usually common tender spots that we'll see with cervical facet pain. So a lot of times they'll have some upper back tenderness or some knots that kind of go on. You can poke on some of these spots and it'll set people off. Now, if we look into the graph onto the right, again, that's that pain referral pattern. So we're going to be seeing, this overall kind of dull, nondescript shoulder pain, right? Because a lot of lifters will run into this issue where they think, oh, I've got, a rotator cuff tendinopathy or a bicep tendinopathy or whatever it may be. And you start attacking these things and you start treating that specifically. And for some reason, it doesn't get any better and it just starts getting worse. All right. A lot of the times, it's not actually the issue. Realistically, it's the neck. So some symptoms of cervical facet pain. We're going to get, if we kind of start, I kind of wrote it backwards. So if we start all the way to the right, one of the first signs and symptoms is you're just going to get neck stiffness. Okay. So with this neck stiffness, you're just going to feel tight up through the sides of the neck and even into the back of the neck. A lot of times you'll look up and you'll just feel more so like a pulling at the base of the skull rather than motion through here to the bottom of the neck. Then it starts to lead into bicep pain. Okay. Now from there, we get a bit of a dull shoulder ache, and sometimes you can flip-flop back and forth. All right. After that, we start to get this burning pain that goes down our arm, that radicular pain. All right, this is when we start to piss off that nerve root. And then the final bit is that upper back burning. And again, that's just the facet. So the bony spots where they join up, they have a specific referral pattern, and the pain can refer down into the upper back, and you just feel this constant burning. There's no sense of relief because nothing can touch it. The reason nothing can touch it is because it's not actually the upper back. Realistically, it's the lower neck. So next slide here. Here's one of my athletes that I've worked with in the past. She's an Olympic wrestler, and she's been having a whole host of neck issues. All right. So as we saw in that video, if I go back, right, and we play that video again, she's going to tuck her chin down. We're going to evaluate how much motion there is at the bottom of that neck. All right. So if you missed it, we're going to go back through one more time. And I want to see how much of that daylight can get taken away when she starts to tuck her neck down. And as you can see, not a whole hell of a lot. All right, so with this chin tuck test, we're just lightly tucking our chin back and trying to drive it down into the table. And I want to see how much motion do we have in that lower neck for it to kind of flatten out. All right, and a lot of times we lose that ability because when we lift, we pack our neck kind of down and back, right, and pack our shoulder blades down and back, where we start to reduce this curve that we have in our upper back. So here I should have a little bit of rounding up top, which then allows me to move my neck. Now I have a really shitty neck, so it doesn't move very well. But when I go up or down, right, I should have some movement within that. So what happens if you're constantly packing down and back with your shoulders and kind of tucking your neck back and trying to have this perfect posture, you lose that curve. And what happens is when you lose that curve, things tend to flatten out. So her neck is already starting to flatten out. When something flattens out, it can't go back any further, right? You can't go somewhere you're already at. If it's already flat, it can't flatten it more, right? So understanding the axial mechanics. And what we mean by this is just axial, meaning dead center, right? So spine and rib cage, not necessarily the joints, which would be appendicular. So it's important to understand spinal curves, right? We were just talking about that. So within those spinal curves, we're looking at, do I have a little bit of a curve which can help distribute the load? Now, a perfect analogy for this is, like, think of it as like stair stepping down. When I go down a set of stairs, right, force gets distributed through each set of stairs as I go down. Now, if we just stack the stairs all at once and I just step straight down onto it, that's a whole hell of a lot of load going through the steps, right? So we want that curvature to help offset some of the load that's going to be going through our spine, right? Other thing is our ribs are meant to move, right? We're kind of taught, the ribs are just there and it's a really firm structure when realistically they're not. Right, we do have a set of ribs that are attached to the sternum that tend to be pretty fixed, but they still do have some movement. But then we've got our false ribs, right, and our floating ribs here that are pretty flexible, and that allows us to move a lot. So the more that my ribs move, the more that my spine is going to move. Again, my rib cage is attached to my spine. So if my ribs are able to move about and elevate, depress, internally, externally rotate, you bet your ass that my spine's going to be able to move with it. Right, and this is important because ribs and spine create motion in the extremities. Right, we've all seen the power lifter that's kind of packed down and back and that's super stiff, and they kind of waddle through the room when they have to walk, and it's because they've lost the ability to rotate and depress these ribs. So now everything is driven from extension. Well, when I do that, now my shoulder and my hip don't move nearly as well. The movement becomes predictable. It's almost like it's glued together in my body, right? So if I can get my ribs and my spine to be a little bit loosened up and moving a little bit better, my shoulder motion, my hip motion, and all the other joints that go along down the chain, those are going to be able to move a hell of a lot more. All right, so now we're going to go into a little spine cog breathing. So this is a drill I like to use because we're coupling cervical and lumbar motion. So all we're doing is we're creating ribcage elevation and depression, right? We're arching up to the ceiling when I take this big breath in. So when I breathe in, I lift my ribs up to the ceiling and I arch my low back and I tuck my chin down. Right, we're creating the length. They're going to get a bit of pull through the musculature that runs up and down that spine. When I breathe out, I blow all the way out. My obliques start to pull down on that rib cage. I crush my low back into the table and I tilt my head back. Now, naturally, when your ribs come down, your neck naturally starts to pop up. So we just want to emphasize that a little bit more. We're just helping guide the motion. Again, my ribs are going to kind of move separate into the neck. So if this goes down, this goes back. If this comes up, this goes down. All right, so we just layer in breathing strategies into what we do with a lot of these, right? We can use, a 1 to 2 count. We can box breathe. We can do whatever we want from here to achieve certain adaptations. But realistically, the goal is just to kind of time up our breathing with our rib and spine movement. Right, this is a super easy mobility drill just to get things opened up a little bit more. So again, we'll watch it one more time as we just breathe in, arch up, right? Tuck that neck back. We breathe in, we arch that rib cage up, all right, we tuck our neck down, and then we just reverse it going back. Other thing we have is our shoulder and neck cog. Now with these, we're just coupling cervical and shoulder motion, right? So as we spin this arm back and forth, right, we pump up one side, which dumps this neck forward, which kind of throws this neck here into extension on this one side. Meanwhile, we rotate back and we kind of tuck the other way, which then closes off the other space. Now we get this rotational aspect of the shoulder as well, which is super beneficial for stimulating proprioception within that joint, right, which then tends to knock down pain for a lot of people. And the beautiful thing about this drill is it's both assessment and a treatment, right? So as I roll my shoulder through, if I truly have bicep tendinopathy, true bicep pain, when I roll, let me get in the camera here, when I roll this thing forward, I put a shit ton of pressure here on this head of the bicep. So if I truly have bicep tendinopathy, I will have a lot of pain with that. If I don't feel pain with that, it's not really coming from my bicep. Usually it's a referral point for my neck, all right? So again, we're going to watch this as we go back. Mhm. So we're always looking to the side of the palm that's up, and we're just getting our rib cage moving side to side, getting things moving independently here, adding in a bit of rotation. So some lifting considerations. All right. I'm a big fan of using these in microcycles. All right. I love to push the weight for a lot of my athletes, but again, I need to be smart about how I do it. The goal with these is to essentially give yourself back what you're going to rob yourself of during training. So if I know I need to use a heavy bench press, we're going to utilize a strategy that's going to support that. So I'm going to pack down and back. My neck's not going to be very mobile. That's okay because it's going to help me press the most weight. However, I'm going to use my accessory work to then give myself back all the benefits that I just robbed of myself by trying to achieve that heavy bench press. Right? A lot of times I'll throw these in as a microcycle. Right? So I'm going to use hook lying bench press. All right. So we're going to be lying on our back, feet up on the bench, kind of digging our heels in, which tucks our rib cage down, which then even frees up space in the back. All right. Other thing is shoulder blade position. This is really common, right? Anyone who's ever seen, the older people that have lifted in the gym, especially the old meatheads from back in the day, when they try and take the bar down to their chest, they can't get it down anymore. So what they have to do is they have to tuck their chin, right, to continually bring the bar down. The reason why is when I tuck my chin down, I naturally round out my upper back, which then moves my shoulder blades more around to the side, which then gives me more space to pack back into. All right. So again, I can use shoulder blade position manipulation to open my back up a little bit more. One of the things I like to do is just take a med ball and I hug around it, all right, and I try and get my arms as far as I can around it. And from there, I squeeze in a little bit and I just make some figure eights, right? It's just thoracic cars, right? Some controlled articular rotations. We're just trying to squeeze and open it up and then layer in some breathing. I'm trying to breathe into that stretch that I feel on my back. I can even drop my head around it and try and get into my upper back and my neck a little bit more. Other thing I'll do is alternating pressing, right? So I might have one arm that's held out here, right? And then my other arm right here with it. And one side is going to be continually pushed up, and then the other side is going to bench back and forth. All right. The reason is because on my one side, my arm is pushed forward, so my shoulder blade is kind of wrapped around my rib cage a little bit, which then creates more space because I'm not packed down and back both sides, which would then start to irritate the neck. So if I have one arm pushing forward, that allows me to start packing my right side back, which won't piss off dead center of my neck. Other thing I like to use is rib cage depression, right? So like those drills that you saw earlier with the spine cogs where we're just pushing down and opening up, right? I can use that through 90-90 breathing. I can do that through direct oblique training, right, which we're going to get into next. I can just use that through breath work, which will naturally pull that rib cage down, all that good stuff. So if my rib cage comes down in the bottom front, it means the top back now opens up, right? It's reciprocal. So, for every action, there's an equal and opposite reaction. If I close off the front side, I've got no choice but to open up the back side. And that's when I can start to use these breathing techniques to kind of stretch my back from the inside out. I'm a big fan of oblique training. Again, those obliques are going to attach onto those floating ribs that are down there, and when they start to contract, they will pull the rib cage down into depression and internal rotation, which then again stretches out the back, gives me more space to work into, all that good stuff. And the last thing I like to use is chest supported row. All right, I'm really big on chest supported rows because it fixes my chest and I can get my head over top the bench, and when I do that, I create a fulcrum point. Right, so now when I reach down, my arms wrap around the bench, but my chest holds still. So that way now I'm getting this pull through my upper back. Now if I want, I can layer in some breathing on top of that where I just let the weights pull me down. I'm not worried about trying to pin my shoulder blades down and back. I let it pull me and I just get some deep breaths into that position and just let it open up. Right? You'll get a nice big back stretch, but it'll also kind of take some stress off that lower neck as well, especially if you hang your head off that inclined bench. Okay. So again, real big fans of like T-bar row, incline chest supported row, all that good stuff. Anything where it's really blocking my chest from moving. Okay. So lastly, contact info. If any of you all have questions about this presentation, two of the easiest ways to get a hold of me. One, my Instagram. A lot of times I just use it for shit posting on my stories, but I'll try and throw up some educational content here in the mix every once in a while. You can shoot me a DM. I tend to respond like fairly quickly to a lot of this stuff because I doom scroll all the time late at night. Or you can reach out to me at www.inferno-pr.com. Again, my company is Inferno Performance and Rehab. So you can reach out to me there too. It'll get shot right to my work email, and that gets linked to my phone, so I'll catch it there as well. So, everyone likes informal conversations. Usually Instagram works well, but if you have like a really deep question that you kind of want answered, shooting me the email might be a better choice on the inferno-pr.com.